Now we're going to be joined by Dr. David Reardon. He is the Clinical Director of Neuro-Oncology at the Dana-Farber Cancer Institute. He is one of the doctors who treated Senator Ted Kennedy for the same type of cancer. Dr. Reardon, thank you very much for your time this morning. I know your thoughts, as everyone, the nations, the world, is with John McCain right now. And just tell us, from what you know, how serious his condition is.
Well, good morning. Senator McCain has a diagnosis called glioblastoma, which is the most common type of cancer that arises in the brain in adult patients. There are approximately 13,000 cases diagnosed in the United States each year. This is a type of cancer that we do have effective treatments that can help patients for. But unfortunately, like many aggressive cancers, the durability of that benefit is something we have to continue to work on and try to improve.
As we said, you are one of the doctors who treated Senator Ted Kennedy, and there have been a lot of comparisons between the two. But what is the same and what is different with Senator McCain's diagnosis?
Well, this diagnosis has several similar features between the two cases and between all cases, but we know from much research that's been done that there's a lot of variability and difference between each individual case. Senator Kennedy's case was a very challenging one. These tumors, depending on where they are in the brain and their size, their location relevant to important functional areas of the brain, can be even more challenging to treat. And unfortunately, those were circumstances for Senator Kennedy. In Senator McCain, what we know thus far is that the tumor appears to have been fairly small, fairly superficially located, not in a critical functional area of the brain, and able to undergo an effective surgical resection.
And so what do you feel will be the potential next steps for Senator McCain?
The gold standard for treatment going forward is to allow patients a few weeks to recover after surgery, and then they begin radiation therapy, which typically lasts for about 6 weeks. During that time, they take a daily dose of an oral chemotherapy medicine.
As we know, he is quite a fighter, and he wants to get back there to Washington, D.C. Dr. Reardon, thank you very much for your time this morning.